What's up? Are we good? Are y'all ready? Okay. Hello, hello. Good afternoon. Buenas tardes, everybody. I'm Dr. Florencio Urias Aranda III. It's an honor and privilege of serving as your Executive Equity Officer. We're here today for a very important, much needed discussion of awareness, advocacy in regards to World AIDS and HIV Awareness Day. It's an honor and privilege to have you here on behalf of the Adams State University Executive Council and the President. We're just so grateful to have our esteemed panelists as well as our community members and leaders here having this beautiful discussion. Our event is sponsored by the Adams State Equity Board, BU Colorado, and SLV Pride. With that, I turn it over to the much better and talented Vince to talk a little bit about the importance of why today and what we're doing. So thank you all for being here, and I look forward to a fruitful, beautiful discussion by you all.
Awesome. Give it up for Dr. Flo, folks. So, as we know, the AIDS epidemic hit us like a storm back in the day, and the World's AIDS Day is to commemorate that day and to celebrate and to celebrate how far we've come in terms of fighting this disease and HIV. And also, it's become kind of a celebration for the queer community as well, as a lot of this has impacted mainly a lot of the queer community back then. The first World AIDS Day happens in December 1st, 1988 was the first World AIDS Day. And we decided to do it on December 5th because December 1st was a Sunday. And also, it's just the perfect way for Adams State. So hopefully you open your hearts, your minds, and if you have any questions, these panels will answer that. So, and then I just want to shout out another event happening this evening, Trivia Night at Vistas. We have a lot of food. I did all the ordering, so it's going to be good. So don't make me eat all the food. So please come, and we'll have prizes, and we'll learn a lot of LGBTQ trivia at Trivia Night. Sound Gucci? Awesome. I'm going to turn it over here so we can introduce our panelists. So give a warm welcome to our panelists.
Thank you. I don't know. I don't talk very loud. So my name's Jennifer Moore. I work at the Children's Hospital up in Denver, here with some coworkers from our team. Our program is called the CHIP Prevention Program. We are also BU Colorado. I'd love to introduce your panelists today. One of the things that I think is so exciting is your panelists are actually from the Valley. And I include Andrew specifically because Andrew grew up in Buena Vista, so I consider it close. But I'm honored to introduce our panelists today. So we're actually going to start with Andrew. Andrew is a family consultant at the Children's Hospital, so we're colleagues. And Andrew wanted me to share that he was born living with HIV, has been living with HIV for 43 years. He's married with 3 kids. One of them is learning how to drive, terrifyingly. All of Andrew's children are HIV negative, and he has a really interesting experience to share if anybody has questions around how this family came to be, because it was quite the experience. And then, so Andrew works at Children's Hospital with the CHIP program as a family consultant, and on his free time, he likes to run, play video games, and take trips with his family. We have Corrine Johnson. I am always saying that, Corinne Johnson. I'm going to totally mess that up, sorry. Corinne has been practicing as a primary care physician's assistant in Colorado since 2009, primarily in rural health, working with the medically underserved. She received her HIV medicine training in 2013 with a dear friend of ours named Steve Johnson while working in a collaborative HIV medical clinic, which partnered with the Salud Family Health Clinic in Fort Collins and the University of Colorado Hospital in Denver. She then continued working closely with HIV-trained internal medicine physicians while caring for patients on the Western Slope. And Corinne moved to Southwest Colorado in 2023 and is pleased to provide all-encompassing care to patients in the San Luis Valley. So you have a local resource right here. Dr. Andy Russell, also from the Valley. Dr. Andy Russell enjoys working as a family physician in the Edward M. Kennedy Clinic over in Monte Vista because it means that he gets to work with a team and the patient is always at the center of that care. Dr. Russell believes every patient has the right to define what health is for themselves, and it is his role to respect and safely support the patient in an effort to find wellness. He wants to increase healthcare access to marginalized people and places. He has a special interest in treating addiction, especially using medication-assisted treatment, or MAT, services for opioid use disorder. He also welcomes any and all gender-expansive persons seeking the full spectrum of gender-affirming medical care. So I just want to thank you all for attending today. So grateful for you. And our panel is going to talk a little bit about their experience and answer some of your questions. So I'll just let you guys handle the microphone.
You want us to talk? Okay. You don't want to just stare at the microphone? Okay. Should we start off with questions or we talk? Do we have any questions? Good question. Yeah, mine's kind of interesting. My parents both passed away from AIDS, and I grew up with my aunt and uncle. I was the only one in my family to get HIV. My dad cheated on my mom with another guy, and that's how that happened scenario. But I didn't grow up like normal. Like if I grew up now, if I was a teenager now, I'd been thrilled because it's back from when it was HIV to it is now is huge. We've taken so many great steps where I get a shot every 2 months, and that's my medical care. I like to run. I have a pretty normal life with the family. So, but like when in middle school, high school, elementary school, I was sick a lot, and because the meds weren't that great, and I had to take a lot of them, like 7-8 pills per time. So, do the math. That's like 24, 25 pills a day. So it's definitely we've come in leaps and bounds. So I think as the care gets better, hopefully we can get rid of the stigma too. Because definitely I'm in the minority, right? I'm straight and, married, but I was telling Jen last night, I was like, it doesn't matter how you got HIV or who you love or whatever. We're all in this together, and it's not a competition. Like, we're here to support each other.
Okay.
So when you started learning about HIV care, what was that like for a typical person you were working with, and what might it look like today?
So when I started, I was asked, hey, we're going to open this collaborative care clinic. Would you like to work with Dr. Johnson? And I said, I don't think I'm smart enough to do that, but I'm flattered. And they said, no, it's a great opportunity. And it really was, I think, one of the best opportunities of my career in medicine to work with Stephen and get trained by Stephen. When we started, I think the newest med on the market was Stribild. And since then, the meds have just gotten even cleaner, even better, even simpler, down to a shot every 2 months or a pill a day with less side effects. I was reflecting, I think one of the questions you had proposed to think about is why do you like doing this kind of medicine, or what led you there? And I think it's because it was a novel virus in my lifetime that was a death sentence if you got it, to now you live with HIV and you die of old age if you take your meds right and do what you're supposed to do. And I think it's fascinating. And I, like Dr. Russell, love working with anyone marginalized or who doesn't have necessarily a voice. My voice is bossy enough for lots of people, so I like to advocate for patients who might not, be the normal patient walking around. So, yeah. Okay. Now you speak.
Hey, so I think I'm here with the perspective of your average, very rural family medicine doctor. She told me I was coming on as the HIV PrEP sort of specialist. What I think is awesome about that is that every family medicine doctor or PA or NP should be an HIV PrEP specialist, because we're the ones who are doing this. You shouldn't have to go to any kind of specialist for that kind of medical care. And I think when you're in a rural place like Alamosa or Monte Vista, you might wonder, like, man, if I go in and I tell somebody I want PrEP, is my doctor going to judge me? They think that I'm just having sex with everybody. What are people going to think? And I want everybody to know that that's a really normal thing to worry about or to ask about. And I would hope that anybody would feel comfortable asking their own primary care physician. There's probably varying levels of comfort with PrEP. We don't do a ton of it here in the Valley. Not a lot of people seek it out, but if your personal primary care physician doesn't feel particularly comfortable with it, they should know somebody who is. Hopefully they are, because I really believe that it's bread and butter primary care. I think one of the things that, if I had like one message that I'm going to get out here today, it's that way fewer people are taking advantage of PrEP than probably ought to be.
Yeah.
It's a highly underutilized public health measure that is extremely successful. It's extremely safe. Not everybody wants to do it. Not everybody has to do it. But if you're a human being and you have blood in your veins, that means you can get HIV or hepatitis C. These are viral illnesses that anybody is susceptible to through a lot of different mechanisms. So just if you are interested, I mean, anybody's welcome to come see us at Valleywide. There's several of us who really have an interest in this. Everybody at Valleywide has had training on PrEP and should be at least somewhat comfortable and familiar with it. So that's, I guess we'll start off by saying that. Vince?
Can you talk more about what is PrEP and what it does and how is it effective?
Yeah, so what is PrEP? So PrEP, I couldn't tell you how long PrEP's been around. Maybe, I think since the 80s even, they had the first versions of PrEP. But PrEP is pre-exposure prophylaxis. Prophylaxis, big fancy word that means prevention. So pre-exposure, meaning pre-exposure to HIV. So PrEP first came about with, I'm going to use brand names. It's often frowned upon in medical circles, but the real names of the medications are way too long for me to remember. I can't spell them. I can't pronounce them. So Truvada has been around for quite a while. That's still kind of our bread and butter, most often used form of PrEP. It's 1 pill a day. There's other ways to take that we can talk about, but 1 pill a day, 99% effective at preventing the transmission of HIV. The person taking PrEP is the person who doesn't want to contract HIV. The person taking PrEP could be anybody. Anybody who wants PrEP should be offered PrEP, in my opinion. Anybody who is, I would say anybody who has more than one sexual partner, or who has a sexual partner who may be at risk themselves, a sexual partner who uses IV drugs, a sexual partner who gets exposed to HIV or just unknown status, anybody who doesn't use condoms 100% of the time, which is a lot of people, should maybe consider PrEP. 1 pill a day can prevent it. I'll also say some people choose to do it not every single day. Maybe they go on vacation a couple times a year, go to London and visit the bathhouses, and they take their PrEP in advance. Even within 2 hours of taking a dose of PrEP, you can get protection. So does that answer that question of what is PrEP?
Thank you.
post-exposure?
Yeah.
Do you want to take it? Or?
Sure.
And when would that be appropriate?
The few times for post-exposure prophylaxis, certainly if you have a needle stick in a high-risk setting, if you find out, for instance, the person you were having sex with was maybe having sex with someone else who was high risk, you could consider doing post-exposure prophylaxis. So knowing that you had a reasonable risk of exposure and taking a medicine preventatively to prevent you from contracting HIV. So the medicine works by not allowing the virus to replicate, and so blocking that replication so it can't reproduce and take off.
Is there a time frame, if you have a sexual encounter and you're potentially concerned, how soon after that encounter should you get PEP?
There are guidelines on this.
I think it's 72 hours.
Yeah. Yeah.
That's kind of time sensitive, so what we tell folks is go through it.
Yes, it is the best way to get, especially dealing with insurance and the cost of these medicines. Sometimes going through the ER is best. So,
Can I piggyback something on about PEP, just because it's something I'm a little bit excited about? Has anybody heard of DoxyPEP? Anybody know what that is? So this isn't HIV, this is more for other contractable sexually transmitted infections, but in the past, I think it was in the last year, there's come out a recommendation that we can offer DoxyPEP to anybody who is sexually active. Taking a single dose of doxycycline after a sexual exposure can prevent gonorrhea and chlamydia. So that is something that I think is worth talking to your doctor about as well. So sometimes when you hear PEP, that may be what people are interested in or talking about also.
I was kind of wondering about it, and then you mentioned costs. And with a lot of these medications and things like that, doctors' bills and things, how expensive is it on that person, especially if that person maybe is low income or something?
there are a number of protections for patients to be able to get the medications that they need. I believe it's part of the Affordable Care Act that HIV medicine is covered. So if you're insured, it's covered. It might not be the agent you want, and sometimes we have to jump through hoops if there's resistance or we're trying to tailor therapy around side effects or individual scenarios. But insurance covers these medications. If you're uninsured, you can go through the drug company through patient assistance, which is income-based. The Colorado AIDS Project regions often have funds and help, and maybe Jen, you can help me with this. Say, for instance, you have a new diagnosis, an uninsured patient, we want to get them started on treatment, knowing it takes time to get medicine. Sometimes they have funds where they can fund the first month of medicine until we can get stuff going. So there's always options. In this country, there is no reason that a patient should go without access to medication. Good for us, sad for other parts of the world, but it's widely available and affordable.
Thank you.
You're welcome.
Go for it, Ivy.
How would you describe HIV to someone who hasn't really heard of it before or doesn't know what it is?
I would describe it as it's a virus that anyone can get. It's bloodborne, so there's multiple ways to get it. It is treatable. It is not a death sentence. It is not easily transmissible. Even when you are infected and not on medicine, it's still not super easy transmittable, depending on the type of contact you're having. And then you throw the meds on top, and it's really not transmissible. So unfortunately, there's years of stigma and fear around this diagnosis or even talking about it. Unfortunately, I look at it as any other chronic illness like depression or anxiety or diabetes. You take your meds, you stay on top of it, and you're in remission or well controlled. So, and it's not a death sentence. People die of old age who also incidentally have HIV and take medication. I have patients in their 70s who are on medication and still leading very normal lives in terms, it's the diabetes, it's the heart disease, it's everything that affects all of us eventually that gets them, not the illness itself. And I think the most important way to combat that stigma is just being an educated person. Science is here for a reason. Let's look at what the data shows us, and the way to end the stigma is for us to all be well informed.
Can I ask kind of a personal question to Andrew? We had a really fun conversation last night, but do you mind sharing a little bit about what it was like to be a young person? You started dating, living with HIV. What were those conversations like, and what were some of your fears and some of the great things that happened?
Yeah, I think that's the question was about dating and being HIV positive. It's tricky. Growing up, I thought, oh, I need to marry someone who's HIV positive, right? Like that's just kind of what made sense. Children wasn't really a thing. But later, as medicines got better, and I was like, oh, I'm still around. I think I want, so it's tricky. What I tell people is there's no wrong way to disclose your status. If you want to be a poster child, if you want to be the shining knight armor, and tell people everywhere you meet that you're HIV positive, that's cool. If you never want to tell anybody, that's also cool. And there's a far gap in between where it's okay as well. I never wore it on my sleeve. I didn't tell most of my friends and family, besides immediate family, till I was in my 30s, till I was already married. I dated my wife for 6 months before I felt comfortable telling her. We weren't having sex at the time, but I don't judge either. I tell people that I meet at Children's that if, you should always be practicing safe sex. You should always be, just thinking that, someone could have, you just don't know who has what. So you always want to be safe and protectful. And there's a lot of blame and shame, and it's already hard. And sometimes the people that, people are mad that HIV was given to someone else, but they might not even know they had it either, so it's hard, and it's like making a mistake, and we all make mistakes. So, but yeah, it's definitely, it's a tricky, and it's a hard situation for people in the HIV community to date and to find that way of, is someone gonna love me? Is someone gonna trust science to know? My wife does. We have unprotected sex, that's all we have, but that's because I'm undetectable, and I take my medicine, and U equals U means undetectable is untransmittable. So we back off our faith off science. That's how we had children who are HIV negative. So it's kind of just like your comfort level. Not everyone's comfortable with it. A lot of people are. It's a matter if you trust the doctors and the science and the research, and you're like, oh, I can't get it. Okay.
Do people know what he means when he says undetectable? So
Yeah, that's probably a good question.
So let's talk about, this is not my area of expertise, you'd probably speak more to this, but people who are on suppressive therapy for HIV, ART therapy, they'll get their viral loads drawn periodically. They can see how much virus is circulating in the body. These medications are so successful now at completely suppressing the virus. We still don't know how to eradicate it completely from the body. There's still a reservoir, but as long as a person is undetectable with no viral load, they cannot transmit the virus. This comes into my realm with HIV PrEP, because some people say, well, I'm falling in love with this person who is positive, HIV positive, I should be on PrEP. And I say, okay, maybe, and you can absolutely if you want to, but also if your partner is undetectable and has been undetectable for at least 6 months, your risk is effectively zero. And I think this is starting to be understood. I think this is helping with a lot of the stigma that people with HIV are often living longer than people without HIV. My hypothesis for that is because they're plugged into medical care already, and they're invested in their own health, and they're working on that, maybe more than some of my average patients are. But undetectable means untransmissible, and if you're having sex with a person who has HIV, they're undetectable, they're no more risk of transmitting HIV to a person that doesn't have HIV. Maybe less risk because they know exactly what their status is, they've been monitoring it, and there's a lot of people out there who don't know their status who haven't been tested recently. So. There've been a few other hands as we skipped around.
often HIV and AIDS is used interchangeably. Can you all talk about what is the similarity and then what is the clear opposite, or not opposition, but difference?
So HIV is the virus that causes AIDS. AIDS is a constellation of symptoms and the point of where your immune system can no longer fight infection. And it's a consequence of being HIV infected for years and the virus wiping out your immune system. So that is the difference. We really don't see, I mean, I've still seen patients who meet AIDS defining criteria in the outpatient setting, and it's always because they didn't know their status, they didn't get tested. Ostrich with head in the sand, like, if I don't know, it's not happening. And those are the patients who end up with like a pneumonia or some weird infection, who are very sick, end up in the hospital. That's when they sometimes present to care for the first time, which is unfortunate because it doesn't have to be that way. I think my take-home message to a group of college students would be get tested at least once to know your status. If you've had sex with one person, you should get tested for everything, and then you should get tested with every new partner so that you know what you're dealing with and can be proactive. These conditions are treatable now. Hep C we can clear, and HIV we can treat, and I think in our lifetime there will be a cure. So.
And that's a wonderful segue. We are testing, STI testing in the core center from 1:30 to 5 after this. And if you do test, you could get a free gift card.
Hey, Vince, I heard that if I get tested, they're gonna shove a huge swab up my penis. Is that gonna happen?
Not this test. This is a simple needle prick test, and the results will be done in 20 minutes, I believe.
Yep.
And yeah, so come get tested in the core center, get some free gift cards. Know your status, sorry.
Hey Vince, what kind of testing? For what STI?
Hep C, HIV, and syphilis.
And then there's BC for you as well, gonorrhea, chlamydia.
Sandra, what's BC for you?
Alright, and then so for folks under, is it 24, what age? That you can also go get syphilis, gonorrhea, there's another one, chlamydia testing as well, for free.
And BC for you also provides free birth control options. So, yeah.
Sorry.
Thank you.
Can you talk a little bit about why getting syphilis testing is important always, but especially right now with what's going on in the U.S.? Why are we doing more syphilis testing right now?
Because there's more syphilis out there. And it's treatable, it's curable. So, yeah, it's important to get tested. I actually probably, that's like the sneaky one I see the most, where I'm like, oh, I haven't seen this in a while, and there it is.
I think for a while we kind of felt like syphilis was this thing that wasn't very common. It had kind of gone away, it seemed like,
Yeah.
and that's not the case anymore. I think one of the reasons is because for chlamydia and gonorrhea, we can diagnose it with either a urine test, a vaginal or a throat swab, or a rectal swab, which, by the way, if you ever go in and ask for testing of those things, talk about all three sites, because all three of those places can be infected. Throat, anus, penis, vagina, all those places can get infected. But they're simple swabs or urine test. Syphilis and HIV and HCV, which is hepatitis C, they all require a blood test.
How prevalent
Yes.
is HIV now?
Gosh, I'd have to look at the numbers.
As I was doing some reading last night, I did read that there are 30,000 new infections every year in the
Yes.
United States. Colorado's rates, I don't really know, because Colorado is definitely not a hot spot for HIV. Our valley is not a hot spot for HIV. That's great. I'm glad for that. Compared to southern United States or some of the coastal cities, we have pretty low rates. I cannot say the same for hepatitis C, which is transmitted in some of the same ways, mostly by needle sharing. I can't remember the actual numbers of HIV in the United States, but it's more prevalent than we would like to recognize when we're out here in our small town, and it is becoming an increasingly small world. Most of us travel around and have contact with people who don't just stay here in the valley, so it definitely happens, and we do have HIV in the valley, obviously, as well.
It's about 1.2 million in the U.S.
1.2 million people in the U.S. with recognized diagnosed HIV.
Yeah.
And connected to that stat, do you know what is our estimation of how many people are aware of their HIV positive status? If there's 1.2 million positive cases, there's potentially how many?
CDC thinks probably about 130,000 people in the U.S. have HIV but have not been diagnosed. And about 1.2 million know they have it and have been diagnosed. So it's not uncommon.
And I think I read too, this is in the past couple years, but our incidence rate of new diagnoses is finally starting to trend down. I think I read that.
Maybe because of PrEP, we think.
Yeah.
Can we just use the mic because we are live streaming?
Oh, I'm so sorry. Okay, yes.
I sound super loud to myself.
Do you wanna? You need a chance with the microphone.
Right, so CDC thinks about 1.2 million people in the U.S. have been diagnosed with HIV and know that they have it, but the CDC also estimates that about 130,000 people in the U.S. do have HIV and have not been diagnosed. So those are the people who are driving that transmission. It's when you have HIV but don't know it, so you're unknowingly giving it to sex partners, people you share needles with, all that.
So you guys have talked a little bit about some of the stigma that comes with these kinds of things. Keeping sex separate, because obviously I'm sure everybody here knows that sex is stigmatized and with and of itself. Do you, first of all, first question, do you think that the connection to HIV and AIDS to the queer community has anything to do with that stigmatization? And then as the experts, have you read or heard anything about activism that is coming out to sort of combat some of that stigmatism?
I definitely think that. I definitely personally do think that a lot of the stigma is connected to the gay and queer community. Man, I think a lot. I think about it often. I think about the documentary "We Were Here." If anybody's ever seen it, if you haven't seen it, please go watch it. Don't watch it on a plane, because you're going to be bawling and people are going to think you're crazy. But it's about that scary time in the 1980s when people were dying of this gay disease. But
Gay cancer is
right.
what you read in the literature. I'm quoting it. It's not my words, but
Yeah.
So absolutely, that stigma stuck.
But it's not a disease of gay or queer people. Certain sexual practices increase the risk of transmission of HIV, including anal sex. Guess what? Straight people have anal sex too. It can also be transmitted, penis to vagina. It can't. It's pretty rare to transmit from vagina to penis, but it's also possible. Straight people also get HIV. Straight people are also candidates for PrEP, by the way, for lots of different reasons. PrEP is not a medication just for queer people. So as far as what's happening, as far as activism to reduce the stigma, I don't have an exact answer for that. I keep hoping that we're going in the right direction as a society, and I think we are, but then we all know what's going on also nationally, so I think we do have to stand up for science and keep being a voice for for what we think is reasonable. But there's always going to be, I think, a fight for the rest of everybody's life who's here today. I don't think it's going away anytime soon, and we have to watch out for each other and be kind to ourselves and our community.
Can I just say too that so when we first learned about HIV in the 1980s, the administration around that period of time denied that it even existed, and could be hard pressed to even say the word HIV or AIDS. And the first term to define the HIV virus was called GRID, the gay-related infectious disease, or immunodeficiency, I'm sorry. And the queer community actually came together and advocated, and they are why we are where we are today. Organizations like ACTA in San Francisco said this is unacceptable. You know, we deserve the same help as everyone else. So I have to say, and I was a social worker working in HIV care for 20 years, and that we would always say to people, and I don't know if Andrew can relate to this too, the one thing that hasn't changed about HIV in 30 years is the stigma. But to go back to your last point, events just like this is how you change stigma, right? Is you just make people aware. And I also want to take a moment to recognize that we're doing this in honor of World AIDS Day. We're honoring all those people that fought so hard. I mean, they were willing to say, this is unacceptable. You have to give us good health care. You have to say HIV. You have to put money towards this so we can study it. So.
And HIV is protected under the American Disabilities Act, and it should stay there. So if anyone's ever feeling stigmatizing as far as like your community finds out and your rent's high or something like that, you can actually get a lawyer for free. I had the state of Colorado. I didn't make it national because I'm trying to keep my kids out of the limelight, but I sued a tattoo place because I was trying to get a tattoo and they said I couldn't get it because I'm HIV positive. So I had the state sue them, and I mean, I got a few $1,000s. It wasn't about the money, it was more about the like, I told them, I'm like, I want them educated. I want them to know, because thousands of people have gotten tattoos that are HIV positive, so that's silly. Like, we should all be using clean needles and stuff like that. But there's certain circumstances that happen all the time. A local dentist or whatever, and if they get refused, they are protected, and they can have people fight for them so that if they don't want to be in the limelight, they don't even have to have their name used. It's just like, hey, we represent the state, can go after them and do the work for them. Because it happens more often than not, or your friend is your landlord and then he finds out, or something like that. So, just useful information.
Could an HIV positive person donate blood? No.
No. They can't serve in the military, which is interesting, which is like heartbreaking for a lot of we've had several, because we see, at Children's Hospital, we see youth up to 25 years old, and other countries let people serve in the military, and it's very controlled. It's just that, it's that stigma. Yeah, no, even if you're undetectable, I mean, maybe in a really rare state where you're transferring to someone else's HIV positive, I doubt it. I don't think, we're not there yet. So I guess I won't get drafted, but I'm too old anyway. But don't have to worry about that, bummer. So.
What are symptoms if you were to get HIV? I guess what would you look for, as well as how long would it take for someone to even realize that they might have HIV?
So acute HIV infection or illness is often like a virus. It's, I don't feel well, you might have swollen lymph nodes, a sore throat, a headache, a low-grade fever that lasts for a couple weeks, couple days, couple weeks, and goes away. And that's, the virus is actively replicating and attacking your immune system, those white blood cells that fight off infection. And so that's why you feel so crummy during that acute infection. And then often, if you're not tested, patients can go years and not know and have zero symptoms, just walking around symptomless. So they're often not symptoms, but when you talk to patients who get a new diagnosis and ask, do you recall, you're trying to put a timeline together, there is an acute sort of illness that went along with it. I just didn't feel well.
And also, I mean, it works like what doctor was saying, it works very differently in everybody. So AIDS killed both my parents within 4 years. I was 8 and went on medication. How did I survive and my parents didn't? So it's like, it works very differently. There's a term like elite controller. So there's a term like, and I just learned this, and I've been HIV positive forever, where you could be an elite controller and you literally, your body kind of controls the med. Like, you don't need medicine. Your body's just kind of handling HIV. You still have it. You still have HIV, but they're not taking, or maybe choose not to take medicine because they're an elite controller. So it's very different. It works different in everybody. So.
We have about 5 minutes left. If you don't mind, just share final thoughts and what do you want us to know about HIV/AIDS, or anything that you want to let us know, what we should know, what we should get out of this panel, or whatever. Really, final thoughts in the next 5 minutes.
I think my final thoughts are stand up for people who can't stand up for themselves. The people that, I meet so many people that have HIV, and they don't have a voice. They can't have a voice. They'll get kicked out of their home. They're scared that their relationship will be broken up. So if you're educated and you hear stigma, that don't be afraid to stand up for the people that can't stand up. Yeah, and that hopefully that change is coming. I went to Africa this past year for the first time, and it was like breathtaking and eye-opening. And I want to bring 1,000 HIV drugs and help people and stuff, but it's hard. There's too many, and so you just do the best you can, right? And you be the voice for people that maybe don't have one. That's my message.
Knowledge is power, and we live in a society where information is wonderful, but misinformation is terrible, and it's a constant battle. So I encourage everyone to do your own research, and that's not Google, tell me this, like actually look or talk to someone who is educated. But you knowing what it's like to have an HIV diagnosis or know someone in the community, supporting them, just I know this about you, and it means nothing. You're my friend. You're my person. It has nothing to do with the fear and stigma that went around for years. In this valley, if you know someone living with HIV who does not want to leave the valley, at the Rio Grande Clinic in our Del Norte office, Dr. Hermelin Hurley comes down from Denver Health twice a month. She's infectious disease with Denver Health. She's fantastic. And so there are options to not have to leave the valley if you so choose. A lot of patients prefer to leave the valley. It's an anonymity thing, but Herm is fantastic. And so there are options in the valley. And I work with her, so.
I guess my message is, I think the stigma is the big part of it, and let's normalize PrEP. Like, give your buddies props if they're on PrEP. Be like, hey, fist bump, that's awesome. You're taking care of your health and you're being responsible. Again, it's way underutilized, and don't be afraid of it. Sexual health is great. People should be able to have enjoyable, healthy, adventurous sex. Anybody who's judging you, they're probably just jealous that you're doing more fun things than they are. I'll say this also. I don't know much about this company. If you're super worried about going to your local PCP or coming to see us or face-to-face, there's online services as well. I've read mixed reviews about services like Mr. I have some patients who they come to me for all their care, but they still use Mr. for their PrEP, and they love it. They say it's great and it's paid for. So there's options out there. I think anything we can do to remove barriers from getting this kind of care is good. So, I don't know. Take care of yourselves too, and each other.
Let's give it up for our panelists, folks. And then just real quickly, thank you so much for being here. I just want to shout out a couple reminders. STI testing in the Core Center, 1:30 to 5 today. Come show up, get a gift card. Trivia night tonight in Vista's restaurant, I guess. It's in the Rex Stadium on the 4th floor, I believe. 3rd, just kidding, I lied. 3rd floor, Vista's. And then this weekend on Saturday, we have an event at the Core Center for International Students Week. It's an international potluck. So please come from 4 o'clock to about 7 o'clock. We'll be in the Core Center eating food from all over the place and celebrating our international students. Thank you so much for coming here on behalf of the Equity Board, SLV Pride. Thank you so much, and I hope to see you around. If you have any questions, I will stick around. Come say hi to us. And take a sandwich home. I don't want to eat all of those. So please, have a wonderful day, and Power on.
Yeah, of course. I don't